the best, number one and nothing less. Lead me to my destiny. I have waited patiently. I have vision, though I believe. I know I can count on me. So stand up for the champions, for the champions. Stand up, stand up.
Hello everyone, you're welcome to Biology Video Lectures with Akerele Olademeji. Today we'll be looking at mammalian heart, and we've talked about some things earlier on. So today we'll be focusing majorly on the mammalian heart. We're still on the series of circulatory system, or we call transport system. Now, the mammalian heart is found between two lungs, that's within the thorax, and that can be shown here. You see that the mammalian heart is between two. This is a lot of times people think that the heart is to the left. No, it's actually, it's not on the left, but because the left ventricle, the apex of the heart, is found around here, so it makes us feel it's there. No, it's found within the two lungs, and that is called the mediastinum. That area is called mediastinum. So you can see that here, all right? So that's where the heart is found. It's found between the two lungs. However, the apex tilts towards the left, so that's why we tend to feel the pulse there. Now the heart beats for about 72 times per minute. That is under normal condition. What do I mean? I mean, like as I'm seated here right now, my heart beats just normally. I'm at rest. But when there is let's say agitation, say one is scared, you're nervous, or you're angry, or you want to fight, the heartbeat increases. The aim of that is to increase the rate at which blood is pumped, and that is very essential because the more blood pumped to tissues, the more nutrient and oxygen are available for that. All right, so it's and that condition is called tachycardia. Tachycardia is a condition whereby the heart rate increases. Then during sleep, it tends to decrease, except when you're having a nightmare. When you have nightmare, the heartbeat also increases. But however, under normal condition while sleeping, there's bradycardia, which is reduction in heartbeat. Now the heart is covered with a membrane called pericardium, and the pericardium is divided into two. We have the visceral and the parietal. The parietal is the one outside and the visceral is one inside. There are two layers. There's one that is attached to the heart itself, which is the visceral. The parietal is the one outside. So the two of them form pericardium. All right. So, it just helps the heart to be able to move within the thoracic cavity or the mediastinum where it is found. All right. So the heart is made up of the right and left atria. Some book will call it auricles. All right, either way. So the right and left atria, those ones are found up. I will show you that in a minute. Then we have the right and left ventricles. Now looking at this diagram here, you can see that the heart is contracting, relaxing, contracting, relaxing, contracting, relaxing. So this upper part is called auricle. This upper part is called auricle. While this lower part is called ventricles. So this is the right side of the heart. This is the left side of the heart. All right. So it means up we have the auricles or atria, which are small, and we have the lower part, which was ventricles, which are much bigger and much muscular. All right. So now the upper parts are less thick as compared to what lower ventricles. You could see that. Also, the atria receives blood while the ventricle sends it out. That's very important because as we move on, you get to see that the hearts, the upper part, which are the ventricles, they receive blood, while the lower ventricle sends blood out. Of course, where they receive blood from, the atria is different. Where the ventricle sends it out to is different, but they both have that in common. The two auricles or atria, whether right or left, they both receive blood, while the right or left ventricles, they both sends out blood. Now the contraction of the heart is called systole, while the relaxation is called diastole. We get to see that more even when we get to cardiac cycle. So it means that what you can see here, so every time the heart contracts, that's systole. When it relaxes, that's called diastole. So when the ventricle contracts, we call that ventricular systole. When it relaxes, we call it ventricular diastole. And when the atria, which is the one up here, when it contracts, we call it what? Auricular or atrium atrial systole for contraction, then diastole for what? Relaxation. Still moving on. Now the two atria contract at the same time, so also are the ventricles. So you could see, if you can see from that the upper one contracts together, pushes the blood downward, then the ventricle contracts, send the blood out. Now what you need to understand is that what is the contraction is involuntary. Of course, the heart is controlled by the medulla oblongata, which controls most of our involuntary action. So how does the heart contract? Yes, it has an effect from the brain, or it has a connection from the brain, but it's more than that, because even when you remove the heart from the brain, or you disconnect the heart from the brain, the heart still continues for some time, because the heart has its own electrical system, or which we call pacemaker. It has like a battery that maybe you might have heard before, someone saying, okay, the person, they've put or inserted a battery. What they meant to say is that they've inserted a pacemaker. Pacemaker is a cell that or it's a type of tissue inside the heart that has ability to generate electrical impulse, which causes the heart to contract. So it's the one that supplies the energy, or don't even say energy, so to say, that supplies, not the energy, that supplies the electrical impulse for the contraction or relaxation of the heart muscles. So that kind of cell is called pacemaker cell, but the major one is called SA node, which is called sinoatrial node. We get to see that in few slides now. Now, beautiful. You can see, looking at this diagram here, you can see it here, that you can see the SA node, which is found around this place I'm pointing to. Yes, it's found at the wall of the right atrium. Now, you can see there are fibers. So what it does is that it generates the impulse. Once it generates the impulse is spread to the two atria. I mean, the right and left atria. So because of that, the two atria contracts together. Now, part of that impulse that's generated is sent to what? So you can see it's written here, SA node to atrial syncytium. Now, syncytium simply means that they are collection of muscles like that contract together. You stimulate one, all of the impulse spreads to other one, so they contract. That's what we mean syncytium. So basically speaking, so from the SA node to the atrial syncytium, so to the two of them, of course, it's found at the right atrium, but yet it spreads to the left atrium. So they contract together. You can see the branches here. You can see the branches, yes, of course. Then part of it goes to another node called AV node. All right. So the AV node has bundles, that has branches, that will now send that same impulse to what? To the wall of the ventricles. All right. So that's the reason why the atrium or atria contracts before the ventricles, because they are the first to receive the electrical impulse from the SA node. Then afterwards, they send it to AV node. AV node now sends it to bundles of his, then branches, then go to Purkinje fibers. From Purkinje fiber, it gets to what? To the ventricles. You can see the sequence here. Now, bear in mind that this particular slide I'm explaining is majorly for A-level students. As an O-level student, you don't so much need this. All right. So bear that in mind. So when it gets to the ventricles, the ventricle contract at the same time. So that is the movement. So let me show you a slide to help you understand this more. Can you see now how the impulse is discharged from the SA node to the AV node? Now, you can see that part of the SA node here goes to the second atrium. So they contract together. You can see that. Then they send the impulse from the AV node to the branches, then the Purkinje fiber, like that, as I'm pointing there. That's what causes the ventricles to contract together. So bear in mind that the ventricles contract first before, the auricles, I beg your pardon, contract first before the ventricles. So the atria, they contract, they push the blood inside of them. You can see that black thing filling up. So the blood inside of them is filled up. They push it to the ventricles. When the ventricles receive the impulse, they contract together. So that is very, very important for you to take note of. I hope you can see that. Now, moving on, the right atrium is separated from the left auricle. Sorry, yes, the right atrium is separated from the right ventricle by tricuspid valve, while the left atrium is separated from the left ventricle by what? Bicuspid or mitral valve. You know, I'll be wondering that why am I using my right hand to say left? When we draw in biology and medicine, we draw the diagram as though you are the one lying down. So this is my right, this is my left. So if I were to lie down, that means this would be the left, this would be the right. So that's why I'm using this to describe the left and this to describe the right. All right, so please bear that in mind. That applies to all diagrams. So you're going to draw the diagram as if you're the one lying down. So that will make us understand the fact that this here, so this is the left, you can see the left from my right, then the right to my left, because it's drawn as if it's lying down. So let's quickly look at this. So you can see that this is the right atrium separated from the right ventricle by a valve called what? Tricuspid valve. I think, let me show you in this. Yes, this is bicuspid valve, this one here, this bicuspid valve here. Then the left atrium is separated from the left ventricle by what? Bicuspid valve or mitral valve. All right. So that is what that slide was trying to explain. Now, the two main heart sound. Now, there are 4 heart sounds when you use the stethoscope, I wish I have mine here. I will have shown you that. Now, the stethoscope helps to perceive the heart sound. Now, we have 4 heart sounds. The major ones that are the most audible, which sounds like lop, dop, lop, dop, like that, is from 2 major events. The first one is from the closure of the what? Atrioventricular valves. What are those? The bicuspid valve and the tricuspid valve. All right. So what do I mean? I will soon go back to that slide to show you what I mean by that. So the 2 valves that separate the right auricle from the right ventricle, right and left ventricle from the left auricle, sorry, the left auricle from the left ventricles, the bicuspid valve that separate that, they contract together. All right. So when they close together, I don't mean contract, they close together. That first close gives us our first heart sound, which is lub, L-U-B-B. That's what it sounds like. All right, when you use a stethoscope. Then when the semilunar valves are found in what? In pulmonary artery and the aorta. So yes, pulmonary artery and the aorta. The 2 of those valves has they have this semilunar valve in them. When they close, also they are the ones that gives us the second heart sound we hear. So bear that in mind. So when I say atrioventricular valve, it means the valve that separates the atrium from the ventricles. I say atrioventricular. So and there are 2 of them. So because those valves closes together, also the valve in the pulmonary artery and the aorta, they closes together. So those one will give us what? Our second heart sound. Let me see if I can quickly show you that here. Okay, looking at this, you can see that this let me use the other one that shows us more. Yes, beautiful. So the closure of this one, tricuspid valve, and closure of this one, bicuspid valve, is the one that gives us the lub, the first heart sound. Then the closure of this one here, you can see that's the semilunar valve in the that should be the pulmonary artery. It's not shown in blue here to show us. So that's pulmonary artery. So as it's happening here, it's also happening in the aorta. That is not shown in this very diagram. So that one gives us the closure of that semilunar valve. You can see this one here gives us the second what? Heart sound. All right. Now the muscles of the heart are made up of cardiac muscles, as the name implies, which is voluntarily controlled. All right. Now the muscles are made up of cardiac muscle, I already said that, which are striated. That means they have like a segmentation, so to say. Let me see if I can zoom this in for you to see. So this is what we have here. So that branch you can see. So these are intercalation. You can see there. It's just like striation simply means they have some pattern, so to say, and it makes it to contract. This branch makes it to contract as a syncytium. Syncytium means, like I said, that like branches like that. So that's how heart muscle is. So you stimulate a part, other parts get contracted at the same time. So it contracts as a unit. That syncytium is what helps heart to contract as a unit, not like a part. So that's why the two ventricles contract together, the two atria contract together. All right. So rounding off. Now let's quickly look at this simple diagram for examination purpose. Of course, all those other points are also for examination purpose, but for easier diagram for you, this is simple. I still have another simpler one than this. You can see how the blood enters the atrium, the right atrium, from the inferior and superior vena cava. Don't worry, when I will soon explain pulmonary circulation and systemic circulation, then you understand better. So you can pause the video here to draw this diagram and follow the arrows. This diagram is very, very, very nice and simple. It shows almost all the part of the heart. So, but this is a section actually. It's not. I mean, it's showing the inside. You can see the tricuspid valve here. You can see the bicuspid valve here. All right, and you can see the semilunar valve here. So it's not all that shown, but I think most of the